Hello and welcome to the Do Something Admirable podcast. My name is Alex. My patients call me Dr. Watson, or also Alex. This podcast name is a play on both the name of our medical practice, Admire Medical, and the previously unspoken mission of the practice. We help our patients rise above the waves after life-changing events or reach new depths exploring their passions. But this show is for anyone looking to be inspired and then inspire others to do something admirable.
One of the segments that we want to kind of push in here is just kind of the benefits of what you guys are doing at Admire and some of the things that you're bringing the masses as far as that can help. And I know you have an article you want to kind of go through. So what is that?
Yeah. So the preamble to the article goes along with the effects of blood sugar on the brain in terms of being a risk factor for cognitive decline. So, of course, brain cells, like all of our cells, run on energy, and if you're not supporting them well enough, there's going to be cascading effects of dysregulation of electrolytes and the protein cleanup, all that stuff. But, people always liken the brain to a muscle, and you gotta work it out like any muscle. And of course, it's not exactly a muscle, but similar effect in terms of one of the best things that we can be doing for our brain is to stay engaged socially, but also to challenge it. And so there's always the anecdotes of people that are more the anecdotes, there's studies on this, of multilingual folks who have lower rates of cognitive decline, and people with advanced degrees, lower rates of cognitive decline, and musicians and things like that. And of course, the reason why is if you are challenging your brain across your whole lifetime and still giving it reasons to work kind of hard and release all those neurotrophic factors, so things that are supporting neurogenesis, so new brain cell development, or the neuroplasticity, so rewiring and really increasing its resilience effectively.
Yeah.
You kind of prehabbing your brain for all the stressors of life accumulating into this cognitive decline down the line. One thing that they think is going on there is you're giving that, it's more of a reserve kind of factor. This cognitive reserve is what allows us to still take a few hits over a lifetime in our brain and not even notice it.
Right.
And that's a good explanation for why a lot of times you can do an MRI on somebody who may be perfectly normal cognitively in their older age, and you see volume loss. Or you have someone who's visibly impaired and their brain looks more or less normal grossly on an MRI. And it's probably a combination of a lot of things like everything else in medicine, but one of those factors is having that the elevated baseline of function. So being able to do those advanced tasks later in life, again, you can take a few hits and still keep on marching and not really notice it.
Yeah, and I see that now with our journey you've been helping me on with weight loss for, I think we're about 120 days in now. Just the difference from 120 days ago to now, just brain fog without, there's no magic pill, right? It was just exercise at this point.
Exercise and sleep, man.
And in sleep, and then the other great one too, which is, kind of forcing that 8-hour sleep day. There is a big piece that I see now that's so much clearer, that my mornings are so much more productive now, where it took me a couple hours to get, get rolling. It's immediately, my wife would say, I can't shut them up in the morning when I'm in the shower, but it is good. Keep going.
No, that's cool. And actually, going back to everything in health is connected, all those benefits you're talking about then reduce your risk for depression and mood disorders that they themselves are risk factors for cognitive decline. And exercise and the good nutrition helps you sleep better, which is when your brain's getting all that junk cleared out anyway. So it protects your brain, long-term aging, all that stuff. So this article is about another risk factor that's being talked about more recently, which ties back into the social connection that's important for maintaining brain health, and that's hearing impairment, and the risk of hearing impairment being tied to cognitive decline as we age. All right, so this is an article that came out back in fairly recently, just 2021. And what they did was they looked at a large data set in the UK, and what's called a retrospective study. So they didn't do it prospectively. So they didn't put these folks into a study and say, all right, we're going to watch you over time. So that's one of the limitations. When you're looking backwards, you have a lot of biases that might come up, selection bias, all that kind of stuff. But in this case, they looked at folks who, at the initial period of the records they were looking at, were in a group of mild cognitive impairment. And that's, in some cases you just call that age-related cognitive decline, nothing that's too spooky. And that is objectively measured on certain cognitive tests. You'll be in a certain range and say, all right, it's just mild cognitive impairment. And then if it worsens, you're in kind of a more dementia textbook picture here. So this one used the use of hearing aids to track, to see as the intervention here, and how many of the folks who had the hearing aids progressed from that MCI to full dementia versus the ones that didn't use it, their progression. Now, immediately you can say, well, one of the potential flaws of that kind of design is people that are using hearing aids, maybe they were using them more because they didn't have dementia. So is it a kind of self-fulfilling kind of thing there?
Right.
Tough to say on a retrospective study, but the beauty is you take this and then you do a prospective after that. But it was a pretty good sample size of over 2,000 people, and what they identified was that there was a 27% lower risk of progression from mild cognitive impairment to dementia in the folks that had the hearing aid. So, like I was saying before, the suspected reason behind this isn't anything special about the hearing aid itself. It's that you're then able to maintain interaction with the world around you a lot more.
Right.
You need that intellectual stimulation. You need to not kind of regress back into your own mind and detach almost.
Yeah. Depression the same way, sort of, right? I mean,
right.
Right. I mean, if you don't get help for depression, eventually you're going to revert back to a really dark place. No, I mean, it makes sense. Especially when you get into your 50s, and you realize that you're starting to be on the doorstep of where your older relatives that you remember are, and it is something that's scary. And I think the more study that's done about that, the more, and again, going back to the education, the more we educate ourselves of how not to get there is important.
Well, I mean, I think I'm grasping at an old conversation from a while ago. I believe there are plenty of surveys that show people's biggest fear medically is Alzheimer's and dementia, because in those cases, even compared with other terminal illnesses, in most of the other ones, you're still there, cognitively. And that's what a lot of people, their sense of self, of course, comes from their thoughts and their self-identification and their social behaviors and all that stuff. So you take that away, and that's people's biggest fears. So not only do you have a terminal aspect, but you also have a terminal aspect that removes you from the picture.
And puts a burden on
the family.
Significant other, right. And potentially, right. And no, that is, and again, and taking it way back, right? So what is your thought process for that? Of course, there's no anti-aging, right? There's no such thing, but
not yet.
What is that lifestyle, in your opinion, as you kind of see through your patients to help them prevent that? Getting to that stage where dementia is a major problem in their lives. What is that? How do you take us through kind of your 30s, 40s, 50s? What can you do?
That's a great question, and I'll always start by saying everyone's unique in this aspect. You want to target different things. Excuse me. Generally, though, I kind of think of it as it's very similar to prehab, of course, but in this case, your prehab period is decades,
right,
and the finish line date is whatever you would have assumed the bad thing would happen. So in this case, I think the average age of onset of cognitive impairment is probably the 70s or so. I'm kind of roughly guessing there. Yeah. Without going too into the weeds here, there's a lot of subtypes of dementia, right? So multi-infarct dementia is what it used to be called for vascular dementia. And that's essentially just a series of strokes in the right places that cause this cognitive impairment. Yeah. And it's usually a stepwise decline. So you're going to notice that instead of being a gradual decline of function like Alzheimer's and some of the better known ones, this one's going to be you're kind of at a certain state, you get worse, certain state, get worse. That one is very dependent on whatever your risk factors are for that. So there are autoimmune conditions where your blood vessels are going to be inflamed and cause problems. But then there's a point to all this, I promise. Then there's also frontotemporal dementia, which is what recently Bruce Willis was diagnosed as having, and that one's a kind of its own bird in my mind here, just because it doesn't behave a lot like some of the other ones, in that it usually hits earlier, it's usually faster, and its behaviors are pretty unique to it because it being frontotemporal, it saps all that executive function kind of stuff. And without describing too much of medical trauma porn here, but I had a patient once when I was actually a tech in a psych hospital, so my first job in medicine, and we had a guy, he's a dentist, and this kind of goes in the face of that, high performing, high education, being protected, but this is why frontotemporal dementia is a little different. He was in his late 40s, early 50s, and started just being kind of inappropriate, right? And that, again, frontal lobe is that executive function, self-control, impulse control, all that stuff. And at first he started doing just odd comments and was kind of rude and whatever else. Then he started making bad decisions where, like, he took his kid to a amusement park or something, and she went into a haunted house, and she was like 5 or something, went by herself in this haunted house, and he just went across the street and got ice cream, and like had no idea that what he did was inappropriate. And so then his family's like, hang on, something's going on here. So they took him to us, thinking that he was having some sort of a manic episode or something like that, and as an etiology of his inappropriate behaviors. But you don't have a kind of first onset of that level of psychiatric illness at that age, typically, unless there's stressors and all kinds of other stuff. And then luckily one of our, this is going back like 15 years, so a little fuzzy on who it was, but one of our, I think this is one of our geriatricians or older adult unit psychiatrists was like, this looks like frontotemporal. So they scanned his head, and sure enough, atrophy was very clear in the frontal lobe. And at that age, you wouldn't expect any sort of volume loss to be potentially not significant. And
is that in the same line like concussions, for example?
That's more of a CTE, so chronic traumatic encephalopathy, and that one doesn't really. Well, it has similar features, and this is getting a bit out of my specialty area, because that does have some aggressive behaviors and things like that, which would be
because you hear that with football players, like ex-football players,
and
NFL and things, right? Yeah, exactly, right.
Yeah. You watch Tom Brady roast,
horrible
jokes. So the reason why I bring those up first is because they don't really fit this kind of paradigm as well. Because there may be more recent research than I'm aware of, but there isn't a clear known cause of these things. Of course, family history is always a factor and stuff, but you wouldn't expect that it's just to be the effects of blood vessel disease and that kind of things that will give you a higher risk by itself of frontotemporal dementia. Or vascular dementia still kind of hits the older adults more, just because that's when you're going to have that time under the curve here of exposure to all the things that will damage blood vessels. So thinking about the long-term risks and things we want to be modifying here, it's similar to prehab in the sense of all the preparation aspect, but there's certain different goals. So when you're preparing for a surgery in 6 months or even shorter, you don't quite care as much about cholesterol and those things, because even though there is some inflammatory component of saturated fat, we're willing to sacrifice tight control of lipids for the sake of better control of blood sugar. So someone, the best example is if somebody wants to go on a ketogenic diet because their blood sugars are out of control and they have a surgery in 2 months, I'm like, go for it. And if your cholesterol spikes in 2 months, it's not going to be a significant thing, as long as afterwards we kind of fix the problem. But overall, it is similar kind of goals and risk factors: increase activity, improve sleep, control pain, and those things. And really what you're trying to do is prevent that interlocking web of one thing sabotaging the others. So like I was saying, the exercise, of course, is going to be, you want to build a lot of muscle mass, because directly it's going to improve your ability to store blood sugar that's circulating, because that's our biggest reservoir and place of storing blood sugar. It's not your liver, like a lot of folks, including myself, think, until you kind of get into the research on that one. But then also muscle tissue and physical activity and exercise releases a lot of anti-inflammatory myokines, they're called. Basically just little circulating molecules that turn down inflammation. So that's another secondary reason why exercise and muscle mass is really good and protective of the brain and just general aches and pains and arthritis and all that stuff, because it's going to lower the inflammation that's going to be accelerating some of the issues that the other stuff can do. But then for the same reasons that exercise is anti-inflammatory, it's also going to help support good quality sleep and restorative sleep. And again, that deep sleep phase is when your brain's, the glymphatic system was kind of a new term that came out in the past couple of years, where they realized that you essentially have this, the cerebral spinal fluid and everything is washing over your brain at night. And when you're sleeping in the deep sleep phase, that's when all the brain cells and stuff are cleaning up all the junk and the wear and tear from the daytime and refreshing you for the next day. If you don't get into that good quality sleep because of either short sleep or mental illness or alcohol and certain sleep medications that actually blunt deep sleep, you're not going to get that benefit.
What's the number of hours you think for sleep? Is it 8? Is it 7? What's your...
Everyone's different, but 7 to 9 generally.
7 to 9, yeah.
And I'm going to be stealing from Matthew Walker here, so if you haven't heard of him already, you should definitely be listening to his stuff too. And no guru is without criticisms, but generally I take a lot of his stuff at face value because he's very well researched in the area. But if you take people out of our modern environment and stick them into a place with no electricity and I think the study he cites was in like Sierra Nevada or something. They took these folks and put them in a cabin or something without the normal cues that we have to stay awake. People end up reverting to I think it was like almost 9 hours of sleep a night or something like that. And I used to be able to, of course, sleep 9 or 10 hours, but there was a U-shaped curve of benefit here where the most healthiest sleep time is between like 7 and 9 hours. Shorter than that, and obviously it's bad. Longer than that, and this is the correlation versus causation thing, longer than that, you think more sleep is better sleep,
right?
But you're actually getting more sleep because it's not as high quality sleep.
Right.
So it's not as restorative for one of the reasons that we mentioned, either medications or alcohol use and other drug use and stress and all that stuff. Yeah.
And keep going. This is great stuff. This is you and I talk about the layman stuff all the time. I think the important stuff that I think people need help sorting through.
Totally.
We see so many, because we could probably go on TikTok and find 17 different things that said get 5, get 7, get 12.
Yeah.
And I think these are the types of things that you go through that as you go through your 20s, 30s, 40s, and 50s, right? That's when you're I gotta say your 20s, your 40s when you think you're invincible. Mm-hmm. What are those other quality things that we can do to make sure that those, I'd say, final decades with your golden years, right?
Can be your golden years, if you prep well. Yeah. So to finish up the sleep thing, it's just very important to make sure that you're prioritizing it. And is the recent worsening of mental health and everything a factor of bad sleep, or is it the reason for the bad sleep? Right. But whatever the reason is, right now I think we're averaging the lowest amount of sleep our society has ever averaged. And is it the work pressure we're putting ourselves under? Is it the constant connectedness, and so you can't turn off your work brain? Yeah. I don't know what it is, but whatever the reason is, we gotta do something about that.
And you have to be purposeful. I mean, you have 100%. You have to be. And when we kind of reset me, that 120 days ago, like 10 o'clock, I'm in bed. I don't care what I'm doing. The show's turning off in the middle of the show. If we're watching a show, like, I'm going to bed at 10 o'clock because I know that I'm going to get up at 5:45-ish, right? And I want that 8-ish hour sleep, and you have to do it purposely. Yeah, you got to get that sleep opportunity, because whenever you go to bed is not when you're falling asleep, of course. Right. So your sleep opportunity has to be longer than you're anticipating your actual need, right? Knowing that you're going to fall asleep later and wake up sooner, likely, than you intended. So besides the sleep and the exercise, and to finish up the exercise too, I might have said this on a different episode of the podcast before, but there's no best exercise. Right. It's whatever you're going to do. Because with everything, sleep, diet, exercise, medications, it's the consistency that matters more than the intensity of any single day of that intervention. So whatever you can do consistently is the best thing for you. If you have the choice, of course, mix and match. Yeah. Some sort of complement between some resistance training to get that muscle building benefit, and then some kind of aerobic training, because VO2 max is a measure of the max amount of oxygen you can use. Your body can push through. Exactly. And without iPhone told me that, by the way. And those are two different independent markers of health, wellness, and survival. And but simple as walking, right? Like if you're talking about getting started, like he's asking me, because I'm hitting at least roughly 10 pounds a month now. And everyone's like, what else are you doing? I'm like, walking and calorie deficit, right? It's that simple to start. There was no investment in equipment or anything like that. It was a great pair of shoes, and and in all honesty, that was that was
some leave.
Yeah, some leave, and just taking that hour and going and setting it, like, again, brushing your teeth. You gotta have that. I'm going to get up. The first thing I'm going to do, and it's out of the way. And then, to your point, then adding the things on after that. What is the resistance piece and stuff like that? But it doesn't have to be daunting. It's just a simple,
find what you enjoy
casual
doing.
Walk for an hour is going to make big dividends if you're aligning that with the right choices on the food side.
Yeah, and there's the adage, you can't outrun a bad diet.
That's right.
In some cases, depending on your goal, you sort of can if you have to, but for the best optimal health, of course not. You need to have both in line. The last point of the exercise piece too is that even in one type of exercise, there are obviously different branches of that. So resistance training, there's kind of a spectrum of the reps per set and the system you're going to be most targeting. So when you're on the super low rep side, you're going to be working a lot of the strength building aspect. And then you're in that middle range of like 8 to 15, 20 or so. You're going to be built in that muscle building phase more than the strength building, which has its own benefits, of course. Like I was saying, the muscle mass and the storage capacity, all that stuff. Then when you get to the higher end, you're going to get a little more of an aerobic benefit. But even within that, you can get a power style training. So I do box jumps when I can. And usually I'm pretty gassed after a good 8 or 10 of those if the height's right. And in that way, you're getting multiple different kind of benefits here. And they each have different benefits for longevity, for wellness as you age and safety as you age. Because aging safely is almost in a kind of glib way more important than aging deliberately, because you can't plan for everything. So you need to be able to factor in the likely unfortunate falls or whatever else is what's going to really be the thing that does us in, short of a bad heart attack, stroke, whatever.
But it is like you said, box jumps. Someone's going to listen and go, I can do a box jump once, right?
Box jump, it's all relative.
I just had this conversation with a really good friend of mine. He was a professional athlete, and he's in his late 40s now, and he wants to get back into his dad years. He's starting to get in shape, and he was asking me what I was doing, and I was like, I'm just walking. I was like, my heart rate's 125, very steady, trying to burn fat. And he was like, he's like, there's steps at the high school that I want to run up. And I go, cool. I said, the athlete in you wants to run up there, but the common sense guy should just walk. Right. Just walk up those steps and take that little piece. And you and I were talking off audio here a little while ago. Is one of the reasons I first came to you as you kind of put together my care plan was arthritis in my left hip. It was to the point where I would have to grab my pant leg and pull my leg out to get out of the car. And I said to you very frankly, should I not walk? And you were like,
definitely walk.
Yeah. And here we are 100 days later, and I'm saying probably, and again, there's no science behind the percentage, but roughly 80%. I'm feeling way less pain. Last night I literally had a 15-pound kettlebell on the bottom of my foot, and I'm doing, kind of lifting my legs up. But 100 days ago I had to lift my leg out of the car because of that, and that's because of this kind of plan you put together, which was slow and steady, right? It's not, don't go do box jumps the first day, and and listen, hopefully I am doing box jumps in a year and a half from now, right? But I think that's a big piece of that is you have to start somewhere, and that again, going back to the financial piece is making those little deposits into your overall health as you kind of go, and I think that's kind of where you were going. And
also the other side of the coin, the consistency piece is don't get hurt. Right. So if there's any risk of getting hurt, what's the point? Yeah. Like I was in the gym solo a couple days ago, and now that I switched from, no offense to Planet Fitness, but Planet Fitness to the Y and have a free bar squat area, and I'm trying to get back to my old heavy squat days, and I was about to load up like 365 or something. So I was doing years ago and I haven't done in a little while, and I unracked the bar and I'm about to start, and I was like, well, what's the point? Right. I'm gonna do this for one rep just to say I can do it again. Might as well wait until I can get many reps in a slightly lower weight before I bother with this one. It might certainly can push the move the needle in terms of building strength, even on that 1 or 2 reps I could have gotten, but at what cost?
And we'll talk more, I think, on other podcasts. Is one of the things we have on deck is to talk about strength training overall.
Oh, yeah.
But what is your, this is something, again, you get a million opinions on, and whether it was 20 years ago or 10 years from now, it'll still be the same, is higher reps or heavier weight, lower reps? What do you feel?
Well, it goes back to that continuum I was talking about before, where it's strength to muscle mass to aerobic. And for someone who enjoys that way more than other kinds of training, aerobic or whatever, I say pick the 2 ends of the spectrum and work those 2. So you're still doing resistance training if that's what you love doing, but you're hitting basically 2 different muscle fiber types.
Yeah.
And there's been some evolution, even in my med school education, of muscle fiber. I actually have numbers for these: type 1, 2A, 2B. In actuality, in humans, apparently there are other ones that they didn't even bother to teach us in school. But the insight from this. Let me move that chair before I start making flashlight noises. The insight from that is it doesn't matter what the heck you call them, but there are essentially aerobic fibers that are way better at continuing to do work over time and less fatigable, and then other ones that are very designed to be big, strong fibers that really quickly poop out. And so if you want to be able to either train every day and not overtrain, you can kind of alternate between the style you're doing, very low rep, high weight, very low weight, high rep, and get complementary benefits here. Or if you want to pick one, then I was actually working with Angela about this the other day to just pyramid up. So start on the low weight, high rep, and then just go up to the real heavy weight, couple reps, and then
almost
go back down or move on. Yeah, and you want to get near failure. Yeah. And for new folks or people who aren't training for anything in particular, then you probably don't. I mean, you don't need to go to failure every time, of course.
Right.
But you're going to make the most gains with going through a very nice full range of motion and getting near failure, where you have a couple left in the tank, essentially. Yeah. So you think I could probably do 1 or 2 more. Let me stop here, and this way you can take some rest time and do the next set.
And we'll talk. And this is a great topic. I think we're gonna do another podcast on for sure. So strength training overall. I know that's your DNA there a little bit. You love that, and I think that's awesome. And I think anything else in closing before we end?
I think that look at life as preparation for your later years, and I know there are other celebrity physicians who are saying the same thing. And while I've definitely been kind of molded in Peter Attia's podcast and all that stuff during my training years, it's just a good way to look at it. Whether you agree with all the stuff that those folks say or not, what are you training for? Well, I'm not training for a marathon. I'm not training for the powerlifting competition. Right. I'm training to be able to do what I'm doing, till I'm 120 if we can get that far, kind of thing.
Or just have some good 70s and 80s.
Or great 70s and 80s. And then, they always say you want that kind of square-shaped longevity curve where you don't gradually decline, you just go a long time and then it's over. And to be able to have that kind of very high function at the end of life, you got to anticipate the issues, which is going to be fractures and those things, and then anticipate what you want to do. So if you want to be playing with your grandkids and carrying your own luggage and your own groceries and all that stuff, you got to get that strength and that aerobic capacity, and makes it a lot more fun, and stay consistent so don't get hurt.
That's right.
That's number one takeaway.
That's number one.
Yeah.
Number one. All right. We have come to the end, my friends. All right. Thank you. We'll see you next time.
Another fun one. Thanks, Mike.